Let's make this year's flu season a better one for our post-acute and long-term care residents. Hi, I'm Chris Laxton, Executive Director of AMDA, the Society for Post-Acute and Long-Term Care Medicine. The 2018 flu season has begun and will last through April. You'll remember that last year's flu season was particularly brutal for nursing home residents. This year, we need to do everything we can to prevent that from happening again. The Society, together with the Centers for Disease Control and Prevention, recommends that all healthcare personnel be vaccinated annually against the flu, with a special emphasis on vaccinating individuals who work in or visit post-acute and long-term care settings. There are two reasons for this. First, because of their weakened immunities, post-acute and long-term care patients are at high risk for serious complications from flu. And second, because of the close quarters and multiple caregivers in nursing homes, the risk of flu outbreaks in our care communities is very high. Healthcare personnel vaccinations have a substantially beneficial impact on decreasing the spread of the flu virus during flu season and in preventing flu-related deaths among residents. It's estimated that at least 20% of flu deaths could be prevented if all healthcare personnel were vaccinated annually. This impact would be especially significant in post-acute long-term care because, as we know, between 70 and 85% of all seasonal flu-related deaths occur in those aged 65 years and older. AMDA first published recommendations on HCP flu vaccination in 2011. Now, in 2018, we've updated our guidance to make it stronger and more specific. Here are the highlights. We recommend mandatory annual flu vaccinations for all post-acute and long-term care personnel, meaning anyone who is in direct or indirect contact with residents, such as employees, contract staff, family caregivers, and volunteers, unless there's a medical contraindication. We encourage care communities to provide education for their workforce on the efficacy and safety of the flu vaccine, specifically as an important measure to enhance resident safety. Nursing home medical directors can be very effective here by actively promoting the flu vaccination program in their care communities and by meeting with workers who may be reluctant to get a flu shot. We recommend that employees who don't receive a flu shot wear a mask when in direct contact with residents during flu season, as well as receive targeted education to encourage vaccination. And finally, we encourage care communities and corporations to make the flu vaccine available on-site and at no cost to employees and volunteers. This has shown to improve vaccination rates in our setting. I'm very pleased to report that the Society has been working closely with the CDC, the Immunization Action Coalition, and the National Adult and Influenza Immunization Summit to improve PALTC healthcare personnel immunization rates. And thanks to this important work, the Immunization Action Coalition has set up a specific honor roll to recognize the leadership of all post-acute and long-term care facilities that pledge to adopt a mandatory flu vaccination program for their workforce. But it's definitely a case of good news, bad news. The good news, of course, is that there's now a specific honor roll to acknowledge leadership in our care communities. The bad news, to date, only 7 facilities are listed. We need to work together to get those numbers up, and I know we can. Finally, the Society's website, paltc.org, now has a special webpage with a variety of helpful flu vaccination resources, including a link to the honor roll. If you haven't already, please check it out, and thank you.